How you
Hey,
doing?
Hey, Khaled, how are you?
Good. How you doing? Non-stop action, eh?
It's been busy, I won't deny it.
Yeah. Let's get straight to the questions. Dr. Lowe and two other chief medical officers have penned a letter to Dr. David Williams asking for another stay-at-home order and more restrictions. I guess the million-dollar question is there going to be another stay-at-home order this week in Peel?
There could be. I'm just looking for the letter. I have it right here as well. It's Ottawa, Toronto, and Peel.
Yeah.
And certainly it does ask, here it is, Vera Etches is her name, Eileen Davila of Toronto, and Dr. Lawrence Lowe, and they have asked for more restrictions. And really it's putting more businesses on the non-essential list, more capacity limits in, the Amazons of the world workplaces. Maybe they don't need to operate at 100% capacity, that sort of thing. They have asked for school closing. So far, Peel led the way, and we closed yesterday, and Toronto did so today. Guelph did so as well, which was interesting. Ottawa has yet to do so, but she's a signatory to the letter as well.
Okay. Do you see another stay-at-home order coming this week?
I can't predict. I understand there is a cabinet meeting tonight at 4 to discuss it. If you listen to the press conference today at 1, and I only caught a little bit of it because I was on the GTHA mayor's call, he did allude to other measures coming. So it
Yeah.
could very well be. I mean, I can certainly highlight for you how dramatically things have changed. Once again, I do have the new numbers and new hospital stats, and it is pretty dramatic. It is scary. So there's no question we won't be talking about further openings at this point. And you and I both know that stay home lockdown orders are only effective if they're done GTHA wide or province wide. They're certainly not effective to be done, in two regions of the area, because people move, and we know that to be true. We saw that at the Christmas holidays, at Boxing Day, people flocking to the Milton Outlet Mall, Premium Outlet Mall there, or the Vaughan Mills Mall. No matter what postal code area code you lived in, you were traveling to continue your holiday shopping at either of those locations, because those were the two that were open, and we know that from anonymous and aggregate cell phone data. So they
Yeah.
don't work. They don't work. People will move if, they need something to do or somewhere to go shop or eat. They will go to those regions that are still open. So the lockdown orders are only effective if they're done right across the region, right across the Golden Horseshoe. So I don't know what's anticipated. I even heard rumors of, stay home and don't cross area codes, don't cross zones, don't cross regions. So people in a gray lockdown not going to an area that's green, for instance. And,
Yeah.
some of the holiday areas are, still open marginally. So not crossing over regions. So we shall see. I think
Yeah.
that's up for discussion. We'll see.
Enforcement would be super
That
difficult
would
with
be
that.
really difficult. I think I made that point today. So if Halton stayed open and you want to take your son Utah shopping, would they check your driver's license as you're driving into the parking lot? Say, where are you from? You're not supposed to be here. I mean, how exactly would that be enforced?
Yeah.
So that sounds really, really tough to enforce.
Yeah.
So I don't
So,
know. I don't know that. Yeah, I don't know that will have traction.
so we've heard rumblings that malls might be closing.
I wouldn't
Is
be surprised. Things are really, really bad. Let's go through the numbers, okay? Because we
okay.
like to do that off the top. And he does now know that he has to send. I've got a light here, but it's not working very well. He knows he has to send these to me, so I have them for our call. So it's not looking good. So we're 112 cases, and we've gone 174 cases per 100,000
We're at
uh,
174, and
cases per 100,000.
we have to be at 40 for red, correct?
Yep.
Okay, so we're not even close. Okay.
Oh, we were closest 6 weeks ago when we were 63 cases, and I was starting to advocate red, red, red. I had
Yeah.
a case then. I have no case now. Oh, it gets worse. So Caledon is at 188. They're worse. Brampton's 180, excuse me, 287.
Wow. Okay.
So Peel is 217. The R factor is right across the board over 1.1. We're in fact 1.34. We're worse off. Caledon's 1.18 and Brampton's 1.13. That's where we've been hovering. We had a bump this week. So that means, you know, for every one person who has COVID, 1.34 more people will have it. Positivity rates are very high. I know that some places in Brampton are over 17%. They said at their flu clinic it's 27%, but their average is 15.9. So let's call it 16. Ours is 10%, and Caledon's is 8.5. And when I do have a breakout for the variants, and certainly the UK variant is predominant. There are over 500 cases in there. For the most part, 2/3, 1/3, Brampton and Mississauga again. Although we are the only city that has, oh no, I lied. We are the only city that has a South African, and Brampton has 6 cases of Brazilian. We have 13 cases, but that's the same number as last week. So I'm confident we're holding steady and we've contained those. So if we want to just look for a second at the hospitals, things are really not good at all. Dr. Lowe was using words like the most menacing wave yet. He called it a calamity, what is happening. So there are 15 to 22 cases walking into the hospitals each and every single day. The patients at Trillium Health Partners has been doubling every 10 days. That's huge. We currently have 83 patients with COVID in hospital, but there are numerous that have had COVID and are still hospitalized with unrelated COVID issues, so lingering issues as a result of having COVID. We have 21 in critical care in the ICU, and when you add that to William Osler, it's over 40. It's massive. Hospital capacity is over 100, and they're all transferring patients to other hospitals, including Niagara, Kingston, Ottawa. Hospitals outside the GTA have been told to keep 15% capacity to accommodate our patient transfers. There are more patients in Brampton's William Osler with COVID than there are in the Cordalucci Vaughan Hospital, which is the COVID hospital. And it's pretty typical right across the north of the city, from Scarborough, northern Etobicoke, Brampton, and northern Mississauga, that band. That's where it's hardest hit. And so, of course, we saw that he pulled the emergency brake on schools and has asked for remote learning, no in-classroom learning, to break the change of transmission, largely because of this surge in cases that we're seeing, which is, of course, the spread of the variants of concern.
So let's, the Niagara region, Peel Public Health, actually, they're starting to open up vaccinations to education workers, right? So does that mean that Peel Public Health can, can direct the vaccinations to a certain sector? Just because it looks like Niagara has done that. Why couldn't Peel do that? So,
we were very hopeful that there would be a larger plan around the closings of in-classroom learning, that it would include childcare, because of course it was very quick. The announcement came very quick. If it was something that had been considered over a period of days, and we were hearing rumors that it was being considered, because of course our students, our children, were told to take home all their books, right, all their materials to take home with them over the long weekend. And so I would have preferred to have given parents more notice on Friday, so they could prepare for babysitting and childcare for Tuesday, and also have a vaccination program in place for teachers. So we have had those discussions, and Dr. Lowe has felt very strongly that it had been outside the framework of what had been allowed, but now we see lots of regions breaking the framework, right? So what we saw on the weekend was 4 or 5 hospitals in Toronto vaccinating 55 plus in certain postal codes, and as well people with underlying health conditions in those certain postal codes. So we said, well, why can't we do that? And then of course the Premier announced it today. So that was very good news. And I just saw that York Region has moved even farther, faster. Let's see. have it right here, opening. York Region residents 45 to 59 in hot spots. So by postal code as well. And I did notice that the chart that has been put out publicly is inaccurate because it lists us as an M postal code. And of course in Peel, Mississauga, we're L.
Okay. So I guess the question is, are we going to start doing that in Peel? Are we going to the hotspots in Brampton and Mississauga to get people vaccinated no matter what the age group is? It's not like the province is going to give us any less vaccines if we break the rules. So
you must have been a bug in the ear when I said that this morning.
oh, right.
I said the same thing. I said, what's the penalty? Of
Yeah,
course, they're going to continue to supply us with vaccine.
Yeah.
So that we didn't have the flexibility to do that. And the argument had been anyone who can't work from home will be vaccinated in phase 2. And we're saying, I was saying, and Mayor Brown was saying as well, what we've been doing hasn't been working, going by age cohort. We've been in lockdown longer than anyone. These lockdowns haven't helped drive down our numbers. The variants have taken over. We need to do something different. We need to get vaccines in the arms of the people at the source. Right? Let's target our efforts to the source, which has been in those large workplaces, the Amazons, the Canada Post, but also, you know, the warehousing, manufacturing, food processing plants, all those types of essential workers in those workplaces, as well as our teachers and our transit drivers, and for goodness sakes, any police officers that haven't been vaccinated. Let's get those frontline essential workers vaccinated because they're clearly the ones that are spreading this virus. So we've been asking for mobile clinics to go up to those large employers. Like imagine if you know you have 200 people working at one time at, I'm just going to use Amazon as well again, because we know that there have been 900 cases since for this past year since the pandemic began. You could get 200 people vaccinated right on the spot. Doesn't that make ultimate sense, right?
Yeah.
Or go to Canada Post, exactly. So the response that we received to date is that our resources and capacity have been put into developing the mass vaccination sites, and it's much easier to flow people through those. So that's been the answer to date. But so the councillors and the mayors have been putting a lot of pressure on public health and our public health officials and the management teams about, no, we think we need to go out to those workplaces and get this done, because the approach we've taken, let's be honest, we've been locked down longer than anyone. And yes, while it's been helpful going through those age cohorts and getting our over 80, of course, Lola got vaccinated, yay. You know, our parents and grandparents vaccinated 80 plus, 70 plus, etc. Now we're at 60 plus, which is great, but that's still not going to address the issue of the 30-year-old Amazon worker, right? Or the teacher. And now that we have schools closed until, what is it, the 18th, 16th. So it'll be 18 days is it the 18th? It's the 18th. 16 days in school closures. We can turn this. Yeah, it's the 18th. It's the 18th. 16 days they'll have been closed from April 2nd, right? Good Friday, right through the 18th.
19th is a Monday, so but yeah.
Oh, month. Okay, so 19th. So 17 days, whatever, it'll have been closed. Let's get the teachers done in that time, right? And they're in Niagara, they're doing crossing guards and the bus drivers, the school bus drivers too. This makes sense. Now it's all contingent on supply and willpower and the political will to do it, not the political, because the political will exists. It's with the medical officer of health. When do you interview Dr. Lowe?
When do I interview Dr. Lowe? I haven't in a while.
I haven't. It's not a regular thing like you do with Mayor Brown and I. Oh, okay. So I was going to say you should be asking him directly, because I did. Yeah. I did. But, you know, things have been changing rapidly. They changed rapidly today because the conversations we had yesterday at our emergency meeting, which closed schools, and, you know, us questioning why we aren't getting vaccine now that it's arriving, because now it is arriving. We have it in good supply to the hot spots, to the places that need it. Why aren't we doing that? And then all of a sudden it was announced today, right, by the Premier, 50 plus in certain postal codes and certain professions. Let's get it to the essential and the vulnerable workers, the marginalized people. So that things have been rapidly changing. So I'm quite hopeful things are really going to change. I spoke to the Premier. I texted him this morning. He's called me right back. He said, wait for the announcement. You're going to be really happy. Because I said, we need to address the hotspots. What we've been doing hasn't been working right?
Well,
Lock
he
down,
actually
lockdown, stay home.
he
Pardon?
used your saying about putting out the fire at where the house is burning. He actually said that today. So anyway, so he is listening.
He's
So
listening, yes.
yeah. So let me ask you about the schools. Obviously, yesterday the huge news was all the schools in Peel, Section 22 order, right? And close all the schools. Why was it literally done the day before? Like, was it?
I don't have the answer. I asked the question too.
Okay.
All I can say is the rationalization I've been giving is that we had an inkling it was coming. Students were told to take everything home with them. And I guess Dr. Lowe had been watching the numbers closely over the weekend and was hopefully didn't have to pull that emergency brake, shall we call it, on schools. But in the end, he did. I would have preferred more, heads up for the parents so that they could be prepared and could provide,
Yeah.
get childcare or babysitting in place, because it's really hard to do on less than 24 hours notice. So, I did make that comment that I thought they should be given more warning.
And sorry, did they see something? Was there a big kind of
The trend
warning?
continued. The trend continued. I think, the pictures we saw all weekend long, the gathering of all the cars, the shoppers in Yorkdale. We had restaurants covertly open hosting parties on the weekend. Just the signs were very bad, and we were concerned. The numbers were trending upward and not showing any room for decline. Our numbers are 20% up every week, right?
Sure. So let me also too, if Peel Public Health can use Section 22 to close the entire school system in Peel, Mississauga, Brampton, and Caledon. Can they not use the Section 22 order to close all retail?
Right? We wondered that before as well. Dr. Lowe hadn't been willing to do that before, but I'm wondering if when the Premier makes his announcement this week, whether it's today or tomorrow or Thursday or Friday, whenever he does it, if there won't be more closures, and if he doesn't do it, whether the three medical officers of health will be willing to do it. I mean, I gotta say, I kind of gave my head a shake on the weekend when I saw those shoppers at Yorkdale. I'm sure you saw the Instagram posts. I thought, oh my gosh. And the weather had been nice. Go outside, people. Why are you in? Oh my gosh. And they were not controlling capacity in the mall. They're only supposed to have 25% capacity in the mall. They were clearly over capacity. I'm sure they were ticketed, but that's not the point. That's not the point. People were not using their judgment. So, when the weather becomes nice and people were feeling a little more confident that things were turning around, they start to relax rules. And that's what I think we saw happening. So now it's okay. Let's rein it in again. Let's rein in control of what's been happening and to try to turn this around one more time.
So the Section 22 order.
So can he close retail? I think. Can he do it? He hasn't been willing to close retail to date, but maybe now that he's done it once with the schools, maybe they will be willing. And particularly if he and Eileen are in sync, so at least it's across, almost GTA, Peel and Toronto. I wouldn't be surprised to see malls close. It'd be devastating for our retailers who just opened 3 weeks ago to close again. I mean, I remember how badly we felt for patios last week. They've been open 2 weeks. Many of them were just opening because it took them that long to recall staff, rebuild their patios, order food, and then they closed. It was heartbreaking. And it'll be heartbreaking for retailers if it happens as well.
I walked around Square One today, and there is quite a few stores. No, it wasn't busy today. It wasn't busy today. But I mean, I did see it on, was it Saturday? And there was lineups to get in. I didn't go.
I prefer seeing lineups to get in. Yeah, I prefer seeing lineups to get in than what I saw in Yorkdale. It looked like everyone was allowed in. There weren't any lineups. It was just overcrowded and clearly over capacity.
So let me ask you this question that every parent's wondering as well: is will April break be extended?
So we don't know, right? Like it's not something we can tell today. It's day by day. And, I think he was waiting to see the results after the weekend, whether or not he'd have to close schools. So whether they will reopen for in-classroom learning as of the 19th of April, we don't know. I'm hopeful. We've always said always said schools should be the last things to close and the first to open. So we've not kept to that rule. And we pointed that out to Dr. Lowe as well. There's lots of other things that could have closed, like some of those large manufacturers, not to point out anything, but do we really need people producing sofas right now? Never mind, notwithstanding supply chain arguments, there are lots of large manufacturers that could operate at a reduced capacity, the Amazons of the world at a reduced capacity, then before we close all our small retail.
So let me also too. I know you talked to the mayor of Brampton, Patrick Brown, and he's strongly against closing schools, and said that we should be closing Amazon's factories, right, warehouses instead. What do you think of this?
Yeah, no, we're in sync. We speak many times every day. I sent out a slew of tweets at the same time, and we're supporting each other. We both feel the same way, that we didn't want schools to close. I only have 11 outbreaks. Have 11 outbreaks. He has another 8 in Brampton, right? That's only 19 outbreaks in between Mississauga and Brampton. So
you don't support the schools closing? Would you rather see them open?
Of course, I prefer to see our schools open, but of course I want to support my public officer of health, because we always said we would be guided by science, right? So if he feels strongly that the schools need to close, I have to support that decision. Notwithstanding, I would always prefer to see our schools open, right? I think it's better learning for our youth, our children. They learn better when they're in school with their colleagues, with their friends, right? And of course that their parents are much more productive working from home or having to go to their essential jobs outside the home when their children are at school. Of course, that would be my preference.
Let's talk about quickly vaccines. How many people in Peel have been fully vaccinated or received at least one shot?
Right. So the last time I checked, that number was before the weekend, and it was about 175,000. So let's call it 200,000 by now. Mm-hmm. Okay. Yeah, that's not bad. It's not bad, but we are 1.5 million, so we have a long way to go. Oh, I have some. I do have some.
Okay, I thought you meant just Mississauga.
No, it's Peel, because our numbers are. Oh, I do have numbers of. I do have vaccine numbers. Hang on, I got them on the call yesterday for just Mississauga. Trillium Health Partners said. I want to say it's about 80,000. Of course, I can't find the number when I need it.
So let
me ask staff. Let me ask staff, and let me tell you that I don't know if you saw the breakout of how many people hadn't registered to be vaccinated yet, right? Over 80 was 88,000 people in the province, 75 to 79 over 100,000, 70 to 74 almost 280,000, and 65 to 69 618,000 still haven't registered to vote.
No, sorry. These vaccines, have they already been spoken for then? All the ones that you just said, or?
No, those are the number of people who have not gone to get vaccinated.
Okay.
So, because the medical officers of health were arguing that we can't move to, let's call it 60 plus, because there are 70-year-olds and 80-year-olds that haven't been vaccinated. And their preference initially was to get all the 80-year-olds finished first, and then all the 70-year-olds. But of course, it didn't take 204,000. So I was right. That's in Peel.
Sorry, say that 204,000 is what, Mayor Crombie?
Peel. I'm pretty sure it's Peel, but I'm going to check. I've just asked. I'm just checking with staff while we're speaking. No, so but then what we saw was they didn't account for hesitancy or missing appointments. So if you schedule an appointment and don't show up, they produce. Luckily at our mass vaccination centers, they're producing vaccine real time. So there is no wastage at the end of the day. I understand in Toronto, you can almost get an appointment at any age if you want to take one of those kind of, we call them the lottery slots. At the end of the day, if there's any leftover, sign up and you go line up and try to get one of those. Because once they open them up and start divvying them up, if people don't show up for their vaccine or they've made too much, they use them or lose them, right? They have to They have to inject them. So there have been slots going open. I know of somebody who works at the city who's going today, who's in their 50s, who are going to get the vaccine because they've got one of those.
50 and older though, right?
Yeah, but they've got a lottery slot, meaning they went to a pharmacy and registered and said, if you have any left over, I'd be willing to come in any day, anytime after 5.
Oh, and any age can do that?
I believe so.
Oh, I had no idea. Okay, cool. Okay, let's get to some viewer questions here.
Sure.
Are child care centers going to be closing soon? Do you know?
I think the answer to that is no.
Okay.
I'm fairly confident that won't happen because that is absolutely essential for our essential workers.
So, and I like this question here. It's I hate to say hate is at an all-time high right now. I think just because of everything that's going on. And the question is the city organizing anything to boost public morale during this difficult time?
You know what? That's a great question. That's a great question. Yeah. Remember my COVID Heroes campaign? That was supposed to do that. So we had a lot of people nominated. I want to say 250, and we are going to be announcing not the winners, but because everybody wins. If you're nominated and you did good things, you're going to be a COVID hero. And so I do plan on unveiling a big plaque and then a big sort of structure that says COVID Heroes and a plaque that has everybody's name etched on it, and everyone will get a certificate from myself and council with the crest on it, calling them a COVID hero and thanking them for their efforts. But I know like not everybody participated or everyone heard about it, but we have tried to do little things like that to thank people for their efforts. And because you were promoting it, certainly in Saga, we're one of the bigger promoters of COVID Heroes. So thank you for that. And people in their own way recognize leadership in our community and people who have gone out of their way. I know certainly the faith groups have, different cultural organizations have, so it depends where you are and who you are. Sometimes it's simply, when I walk along Lakeshore and Port Credit, the signs in the windows, right? Giving inspiration and hope. So not formally, formally was COVID Heroes, and that's not over yet. We're just still compiling all the names and, getting them etched on a big plaque.
Cool. I got another question here. Mayor Crombie, if you could go back in time 1 year, what would you have done any differently?
Well, I say this often, our learning of the virus evolved. At first we didn't think we needed to mask. Remember, just keep your distance, stay inside, wash your hands. And then we learned if we wear a mask, we protect other people from us. And I also know that there are countries that wear N95 masks because they learned that protects them as well as the other person. I think Germany and Austria have done that. They've moved to that. Closing the borders or having more rigorous scrutiny at borders would have been helpful, certainly at the airports. There was a call for closing down travel at the airports much sooner than it actually happened. It didn't actually happen until around the holiday time, right? So that was almost 8 months into the pandemic. So it took a very long time for that to happen. So there's, two things for sure we would have done differently.
I think the question is you. What would you have done differently?
Oh, what would I have done differently?
As a mayor.
So again, my learning has evolved as well. I'm trying to think of recognizing people or efforts. We do.
Put you on the spot. It was a question.
I know it's a good question, but mostly I've been looking at the best practices. What have we learned about the vaccine and what could we have changed going forward and how could we have gotten it under control faster, sooner, better? So, also, if we had gone into lockdown in September, October, would we have been in lockdown at the holidays, right? Could we have done that sooner? So we're doing that again, it looks like now. And if we do so now, will there be more relaxation in the summer, right? And will we get more vaccines? And, another change, if I had the power or the money, I would have ensured that we had domestic production of the vaccine. Right, I would have put a lot of money towards domestic production of the vaccine. Closures of many of our small retail and small businesses, that breaks my heart. I wish we could have done that differently, you know, allowed them to stay open with capacity limits. And, you know, I think there are some of the safest places to go because they really care and they want everyone to be safe because they're our neighbors, right? They're local. They're often our friends and family. They're people in the community. But I think domestic production is one that I would have definitely done differently. If I were a federal member, I would have put a lot of money to ensure that we can produce that vaccine here and not rely on other nations. You know, particularly we had a government previously in the United States that wasn't willing to share until all of their people were vaccinated, and that's not the right approach, right? So in addition to vaccines, you know, monthly minimums of requirements for what we were receiving. So things could have happened differently at the federal and the provincial government. Probably more disclosure, I think, more transparency on how decisions were being made. You know, were these frameworks the right way to go? We saw things happening differently in different provinces. So like Quebec had curfews. We didn't have curfews, but we had lockdowns. They had lockdowns. They went to the color-coded frameworks before we did. Could we have moved into that sooner? You know, that's all fine in retrospect, standing here today, 1 year later, evaluating what we did and what other regions did and what we could have done differently. Should we have paid a premium like Israel did to get more vaccines sooner, right? And you just know that the government was criticized because they didn't. And then after the fact, because they spent too much money, they would be criticized because they did. It's a kind of a no-win situation, but certainly, you know, there was an opportunity. And notwithstanding, I think it's completely immoral that these pharmaceutical companies would have been charging a premium so that you could jump the line, get front of the queue. But so these are some of the best practices that, you know, what could we have done differently? And certainly domestic production is one that I would have thought we should have done, and we should still be looking at doing it. And we were doing it in Quebec. We have capacity. We have, you know, pharmaceutical companies here. I'm sure we have capacity. You know, why don't we invest the money that's needed right here in Mississauga and get production? And don't look at me because your municipal government can't do that, but a combination of your federal and provincial can, right?
True.
But masking, remember, it took us a long time to insist that if you were out in public and not able to maintain a safe distance, that you should wear a mask. Remember, in the beginning, we thought as well that the virus would stay on physical locations a lot longer than it did, and we were closing things like parking lots so you couldn't go to the park and playgrounds. Those are decisions I regret, because people needed to be out, they needed to be walking, and children needed to be in the playground. But we thought the virus would be transmissible on the playground equipment. We were learning more about the virus as time progressed. We didn't know. And it broke my heart that we were closing playgrounds for children and closing parking lots so you couldn't walk in Rattray Marsh or in some of our, you know, beautiful parks here in Mississauga. So those are learned experiences, right? Those are learnings that we take with us. But we didn't know how the virus was being transmitted at that time. We were learning.
True. Well, Mayor Crombie, thank you so much. It's been, you know, talking about the beginning. We've been doing this for 1 year now. This is the 1 year anniversary of our.
Was that right?
Our conversations, 45 interviews, over, I think, 3 million views with you and I. So wow. Yeah, but
that's
thank you so much for being here.
March 26th, yeah. I signed the emergency order 1 year.
Yep, that's crazy. Wow. So yeah, here we are.
And it's still in place.
Yeah.
I thought it would be temporary. Honestly, I thought it would be 8 weeks and we would lift it and things would change.
Yeah. So, well, let's, we'll keep going. So, Mayor Crombie, thank you so much.
Vaccines in arms. That's the secret. So please encourage everyone to get vaccinated. The doors are opening. Supply has arrived. Please sign up. Please go get vaccinated when your number is called.
Awesome. Mayor Crombie, thank you so much. I'll catch you next week.
Thank you.